The coronavirus death toll in the United States continues to climb as President Joe Biden assures the nation that help is on the way. More than 4,000 American lives were lost to the virus on Wednesday alone. That brings the national death toll to more than 409,000. A total of more than 24.5 million people have been infected. President Biden is warning that things will get worse before they get better. But the new administration says it has a plan to get the nation back on track. The president released his strategy to fight the virus on Thursday. It includes more testing and vaccinations. This comes as more than a dozen states are now reporting a vaccine shortage. An estimated 17.5 million Americans have received at least one dose. Mola Lenghi has more.
The race to vaccinate hits a major setback.
We are running out of vaccine and we need more now.
It's happening across the country. Promised doses not delivered. New York City today closed 15 vaccine centers and canceled 23,000 appointments.
It's deeply disheartening, and honestly, it does create a little bit of sense of panic.
This as stadiums and other large venues continue to be transformed into vaccine megasites.
It's very disappointing, and once we can get more supply, we can vaccinate more people, but it's out of our hands.
In Detroit,
we've got the convention parking structure where we could handle 25,000 vaccinations a week, and right now we're scheduling 6,000.
At Dodger Stadium, wait times for scheduled vaccines are reaching 5 hours, and California health officials are saying the state may not vaccinate all of its high-risk, high-priority seniors over 65 until June. Also tonight, growing concern over new strains of the virus, especially one first detected in South Africa, which could be somewhat resistant to the current vaccines. One researcher in South Africa tells CBS News the strain is almost like a new pandemic and may require recalibrating the vaccines, much like is done with the annual flu shots. Hospitalizations in the U.S. continue to be at peak levels, and on Wednesday, the second highest daily deaths recorded, nearly 4,400 in just one day, almost matching Japan's death toll during the entire pandemic. The vaccine rollout, slow as it may be, is having an impact. This morning, 93-year-old Irving Levine received his first dose. Levine survived the Holocaust, but lost most of his family. His goal now in this pandemic, to be able to see his kids again. One of them, a doctor at New Jersey's Holy Name Medical Center.
His will to survive has been incredible. In some ways, I almost believe that he's more concerned about me and my sister, because we are working on the front lines, than he is about himself.
There are 15 vaccine distribution sites across New York City like this one that are closed and will continue to be until the city gets more doses. Now, according to the New York Health Department, the appointments that were canceled will be rescheduled 1 week later. Lana?
Good to hear that they're being rescheduled, Mola. Thank you. Dr. Dara Kass joins me now. She's an ER doctor and a medical contributor for Yahoo News. Dr. Kass, as always, thank you for the work that you do. So I want to get your thoughts on the coronavirus response announced by President Biden. Here's first what he had to say about the weeks ahead.
Let me be very clear. Things are going to continue to get worse before they get better. The memorial we held 2 nights ago will not be our last one, unfortunately. The death toll will likely top 500,000 next month. The cases will continue to mount. We didn't get into this mess overnight, and it's going to take months for us to turn things around. But let me be equally clear. We will get through this. We will defeat this pandemic. And to a nation waiting for action, let me be the clearest on this point. Help is on the way. Today,
the new administration is calling for more testing and more vaccines. The Biden administration is also hoping to reopen schools in the next 100 days. Dr. Kass, what do you make of the Biden-Harris strategy, and how important will a unified federal response be in getting this virus under control?
It's critical to us getting to the other side of this pandemic. I can tell you from somebody that's been doing this every single day for nearly a year, it is remarkable to see a 200-page plan that encompasses every aspect of the response to this vaccine, from testing to tracing to personal protective equipment to the vaccination process to reaching out to vulnerable Americans where they live in urban America or rural America. We have been waiting for a unified strategy since the day this pandemic reached our shores, and it is remarkable to see this multifaceted, multidisciplinary, and extraordinary thoughtful plan that's going to really get us to the other side.
What do you make of the idea that within the next 100 days that schools across America might be reopening?
So the plan calls for 100 million vaccinations in the next 100 days. And once those vaccinations, especially as we vaccinate teachers and get testing strategies and better surveillance up and running, we can hopefully get our schools to a more regular pattern. We know there's been a very chaotic opening and closing pattern all year. So I'm not yet ready to talk about whether or not we can open schools reliably. We need to see what happens with getting the virus under control, getting community spread under control, and then actually getting the vaccinations, especially for teachers. But I think that every step forward does get us to the point where we can reliably open schools for students safely and for the teachers that teach them.
Well, as you mentioned, Dr. Kass, the Biden-Harris administration is aiming to vaccinate 100 million people in its first 100 days in office. Based on what we've heard about the president's coronavirus plan, as well as all that you know about the distribution challenges, as well as the manufacturing challenges associated with this virus, or of the vaccine, rather, do you believe that this is a realistic goal, and what will it take to reach it?
So I think it is a realistic goal, and it's certainly something we should try because we haven't tried anything reasonable so far. We need to really lift the highest element of our government, really reach into the Defense Production Act, not just generating vaccine, but also the products that we need to deliver the vaccine, get to distribution centers, and really partner with states and local officials, territories to get their citizens vaccinated as fast as humanly possible. So I am all about big, ambitious goals with the infrastructure and the investment that are behind them. And that's what the Biden team is really putting forward right now.
Well, some states said that they wanted to buy vaccines directly from Pfizer, but the Biden administration shot down this idea. Can you explain why that is, and how can states and the federal government actually work better together?
So I think a lot of that was a reaction to the previous administration and really the coordination that was happening between the federal government and the states, leaving vaccine on the table, that the fact that the federal government was not maximizing its opportunity to purchase vaccines. So states were saying, well, if you're not going to do it, we are. And I think what the Biden administration is saying is, we are going to do it so you don't have to. And so it's really a chance for them to show us at the state level in every state that they will maximize their buying power, get those vaccines from the companies so that the states don't have to compete with each other, which is what we've seen with both personal protective equipment and testing so far. And we'd like to not see that at the vaccine level.
Well, the president also signed an executive order Thursday establishing a health equity task force to address the racial and geographic health disparities in the nation. How important will this be in our fight against COVID-19, and how difficult are the challenges of trying to make sure that everybody, particularly communities that are most affected by this virus, are getting access to the vaccine?
I think this is critical to the realistic and true delivery of equitable and accessible healthcare to the patients that have sacrificed so much through this pandemic. Communities of color, rural communities, the Indian Health Service, and the Native American communities have really been burdened so dramatically with the brunt of this disease, that looking at a task force that looks to their needs and says, how can we prioritize those needs, lift them up, and really address them from an evidence-based and scientific perspective is refreshing but necessary. So I'm very excited that these task forces are being led by scientists who put equity first, and they will really save lives, and lives that have otherwise not been taken, have been taken for granted so far.
Dr. Kass, I really want to get more insight into these new variants of the virus that we've heard about. What do we know about the effectiveness of our current vaccines against them? You just heard Mola Lenghi reporting about the South African variant. I'm wondering, how can we get ahead of these strains in the event that vaccines are not effective, and are new vaccines being produced now to deal with these new strains?
So Dr. Fauci addressed this today at his press conference a little bit, where he said that there's no evidence that our current vaccines won't work against these new strains. And we're getting as many questions as we have answers, and even more questions than we have answers, especially as these new strains pop up. The most important thing is to continue to do surveillance testing and to communicate effectively with scientists in the countries that these strains originate from, and make sure we know when they're coming to our shores as we continue to iterate the vaccine process. If for some reason, and it's not here yet, that there is a reason to believe that any of our vaccines are not covering a new strain. So far, we are pretty confident, we are confident that there aren't any variants that we don't cover with our vaccinations. And I think that the scientists are very clear that we should take the vaccines we have right now, and we should continue to learn and iterate and be humble that there will be questions we will ask that we won't have answers to. But I got vaccinated already. I feel confident that I'm protected as best as we can be right now. And I encourage everybody to get vaccinated when it's their chance.
All right, Dr. Dara Kass, thank you.
Thank you.